Welcome to Culturally Competent Care in Athletic Training. This continuing education course was sponsored by the Ethnic Diversity Advisory Committee of the National Athletic Trainers Association. The Ethnic Diversity Advisory Committee is dedicated to service, devoted to advocacy, and committed to unity. We advocate sensitivity and understanding towards ethnic and cultural diversity throughout the profession and the association. We strive to enhance the growth and development of the NATA, and our objectives are designed to unify the association. Throughout this presentation, we hope to elicit more interest in concepts regarding cultural competence and its impact on healthcare delivery, provide an opportunity for athletic trainers to assess their cultural competence, and convey the importance of cultural competence within the context of an increasingly diverse, physically active population. The objectives for this course include: the learner will complete a reflective self-assessment questionnaire in order to understand their cultural awareness and sensitivity, as well as their behaviors. The learner will also learn about the healthcare perspectives of specific cultural and ethnic groups. And finally, the learner will learn to conduct a culturally based physical assessment. This presentation will be divided into 3 sections. Section 1, Cultural Competence Assessment, will be presented by Jeremy Mara.
Hi, my name is Jeremy Mara. I'm a certified athletic trainer for the United States Olympic Committee, currently working at the Lake Placid Olympic Training Center. I'm here to talk to you today about cultural competence assessment. Before we begin actual cultural assessment, let's talk about the definition of cultural competence. It's an ongoing, ever-changing process that is essential to providing the highest quality of service to the physically active population that we as athletic trainers serve. Key word here is ongoing. It's a developmental process that evolves over an extended period of time. You're not going to finish this video, throw up a fist and say, yes, I am culturally competent. You're not going to get credentials, you're not going to get a certificate that says you're culturally competent. It's an ongoing, ever-changing process that we continue to develop. It develops over a continuum. Some people start over here, some over here, but there's no end point. It fluctuates. So again, this isn't going to make you culturally competent, but it's going to provide more cultural insights for the care that you provide to your athletes and patients. So why do you care as an athletic trainer? Well, let's talk about some of the impacts. Minority is slowly becoming the majority in the United States. The U.S. Census Bureau showed that 30% in 2000 of U.S. citizens were minority. They projected that by 2010, this would increase to 35%. They then projected that by the year 2050, half of all U.S. residents would be considered minority. So these numbers are greatly changing. In the 1999-2000 year, the NCAA started a race and ethnicity study over 5 years. In the 1999-2000 season, 31% of NCAA Division I men and women were of minority. By the 2004-2005 season, this number increased to almost 36%. Along with that number, 11% of NCAA athletes were non-resident alien. So when you add those two numbers together, that means that almost half of the population that NCAA Division I athletic trainers served were a minority. So what's the impact for us, and why does that matter? Well, currently, the NATA only has 11% minority membership. Is this a problem? Maybe, maybe not. But our numbers as athletic trainers definitely do not reflect the active population that we serve. The NATA matrix competencies say that we as athletic trainers should possess the skills for cross-cultural and interpersonal communication. But it doesn't necessarily say how to provide service, how to achieve that goal. So are we as athletic trainers providing that service to the diverse population that we're serving? There are also very few published articles and resources on cultural competency within our profession. Again, is this a problem? Not sure, but could it be? Yes. Some research has shown that athletes and patients prefer providers that are of the same racial ethnic background as them. Some don't. Most just care that we're competent professionals, not just culturally competent, but competent in the healthcare field. But it could be an issue. And aside from just numbers and statistics, there are also medical concerns for certain diverse populations, such as the sickle cell trait in African and Mediterranean descent, hepatitis B in Asian populations, Layton-Tay-Sachs disease with Eastern European or Jewish populations, and varying levels of blindness and albinism. Some culture-specific issues will be discussed later in this presentation. So now that we've identified what cultural competence is and the impact for athletic trainers, let's talk a little bit about your own self-identity. So take a moment to consider yourself and identify which racial, ethnic, or special population groups that you belong to. Are you a diverse individual? And this doesn't just include your race, but ethnicity, language, religion, sexual orientation, ability or disability, and many other factors that may make you a diverse individual. So what groups do you identify with? For instance, when asked what your race or ethnicity is, what do you select? What's your religious preference? You may consider yourself white, but of what cultural background? Maybe you're an Irish American or an Italian American. Maybe you're Jewish or Roman Catholic. These all make you a diverse individual. So also, what groups you identify with, do those groups also identify with you? Why is that important? Well, as an educator, maybe your students identify you from a certain racial or ethnic or special population group and feel more comfortable talking or working with you. An athlete or patient may feel the same way and want to work with you because of a group that they believe you belong to. Do you take advantage of cultural enrichment opportunities? And these can include attending cultural events, membership to cultural or special interest groups, educated on cultural injuries or illnesses that we talked about in the last slide, or special needs populations? Do you volunteer or serve for underrepresented populations such as Special Olympics or serving with athletes with disabilities? So overall, how comfortable do you feel working with people that are from different cultures other than your own? Do you feel more comfortable working with people that are the same as you, that are different with you? Maybe you don't care, maybe you do, it doesn't really matter. But just think about yourself and how you identify yourself and those around you. And also consider, do those people that are around you identify themselves with the same groups that you think they identify themselves with? Going back to talking about, do those groups you identify yourself with identify with you? So, asking the question, do you feel more comfortable interacting with certain people? Think of yourself as the patient or the athlete. We've all been to some type of medical provider. Do you feel more comfortable working with a specific provider? Maybe by gender, maybe by race or ethnicity? Does it matter to you? Maybe it does, maybe it doesn't. But if you're unsure, think of your athlete or patient, and maybe it matters to them. Again, the ultimate goal here is to provide the most competent care that we can, cultural or otherwise. So you've taken a moment to identify yourself. Let's talk a little bit about the athletes and patients that you serve. So how do you racially or ethnically identify the populations that you provide service to? Take a moment to consider these populations and identify what you believe their racial or ethnic groups to be. So which of the following groups have you served, and which groups do you service regularly? So now that you've taken a moment to identify the cultural or racial groups that your athletes or patients belong to, do you feel that these individuals could belong to multiple groups? And again, we talked about this in the last slide. Do you think that just because you identify them a certain way, do they identify themselves as a certain way? Just something to take into consideration. Remember, we may need to adapt the medical care that we're providing to make our athletes and patients more comfortable. It's all about what they need, not what we need. So now that we've kind of talked about our athletes and patients' racial and ethnic background, let's talk about the special populations of athletes or patients that we as athletic trainers may serve. So which of the following groups have you serviced, and which of the following groups do you service regularly? So we've taken a few minutes to identify our own self-identity, to talk about our athletes and patients, and learn a little bit about cultural competence. So now let's jump into the assessment part of this segment. The Cultural Competence Assessment Inventory, the CCA, is used to assess levels of cultural competence among various healthcare providers. The CCA uses two subscales to identify areas of improvement for the provider. Dr. Shim and Durambos were the original developers of the CCA, and this is designed around the four basic constructs that constitute a main piece of a cultural competence puzzle, which we'll look at in the next video. The four levels of this include diversity, awareness, sensitivity, and competence. All four pieces fit together to model a complete holistic construct of culturally congruent care. Over the past 5 years, the CCA has been used in numerous studies identifying cultural competence of various healthcare fields, as I mentioned earlier. It's a self-administered inventory consisting of 30 questions on a 7-point Likert scale. Today we'll not evaluate the entire CCA. We're just going to pull a few select questions so that you can identify some specific needs for you as a provider. This was recently used among athletic trainers. It's the first time cultural competence has been assessed among our profession. So what you're looking at now is two levels to cultural competence. The first level is the provider level, and these are the four constructs of culturally congruent care: cultural awareness, cultural competence, cultural sensitivity, and cultural diversity. For more information on these four constructs, please cite the references at the end of this presentation. The second picture you see is the client, or athlete and patient level. So this includes cultural languages, spirituality, acculturation, values, beliefs, and lifeways of the populations that we serve. So we, as the provider, have to use the four constructs at the provider level in conjunction with the four constructs at the client level to provide that cultural congruent care. And we see how this works in this next slide, where the provider level and the client level come together in the cultural competence puzzle to form that culturally congruent care. So now that we've seen the cultural competence assessment and kind of how it works, we're going to take some time to consider your own cultural identity and the identity of the athletes and patients that you treat. So let's look at a few pieces of the CCA. As you're doing this, try to identify specific times or issues or some ways that you could apply some of the statements that follow. Go ahead and grab a pen and a piece of paper and write down your answers to the following. The following four statements will allow you to critically analyze your own personal cultural awareness and sensitivity. Record your response to the following four statements. You'll have 10 seconds to analyze each. You may choose to strongly agree, somewhat agree, neutral, somewhat disagree, strongly disagree, or no opinion to the following statements. Again, I'll read the question or statement, and you'll have 10 seconds to respond. Let's begin. Number 1. People with a common cultural background think and act alike. Number 2. Aspects of cultural diversity need to be assessed for each individual, team, and organization. Number 3. Individual athletes or patients may identify with more than one group. And number 4. I understand that people from different cultures may define the concepts of healthcare in different ways. So you've had some time to consider various statements on cultural competence. So how do you feel? Again, these were the awareness and sensitivity questions. So which of these statements did you agree or disagree with? Did you find any of them something that you wouldn't necessarily consider or have never found yourself doing? Or maybe you see yourself doing this quite often in your assessment. So again, do you already consider these issues when treating different patients and athletes? And do you adjust this based on the clientele that you're treating? So we've taken a few moments to look at the four statements for cultural awareness and sensitivity, and now we're going to dive into our own personal cultural behaviors. So the following 5 statements will allow you to critically analyze your own personal cultural behaviors. Record your response to the following 5 statements. You'll have 10 seconds to analyze each. You may choose always, very often, somewhat often, sometimes, few times, never, or not sure. Number 1. I include cultural assessment when I do athlete, patient, or team evaluations. Number 2. I ask people to tell me about their own explanations for athletic training services. Number 3. I seek information on cultural needs when I identify new people I interact with. Number 4. I avoid using generalizations to stereotype groups of people. And number 5. I document the adaptations I make with the athletes and patients when I provide service. So now we've taken some time to identify cultural behavior. So do you find yourself identifying with scenarios on how to apply these behaviors? And do you find them practical? Do you think some of these behaviors are something that you may incorporate into your everyday